Hi, Mr. Ray. Adrian Atkinson. I'll be the nurse practitioner student seeing you today.
Hello,
How you doing?
doing well.
And what brings you in today?
My normal checkup.
Okay, and how would you describe your overall health?
Good.
Okay, and any complaints you wish to, or any concerns you wish to discuss today?
Ringing in my ear and heel pain.
Okay, and what's going on with the ringing in your ear? Is this something that's new?
Not new, no.
Okay, and how long has that been going on?
7 or 8 years, maybe longer.
Okay, and can you describe the ringing in your ear for me?
High pitched and constant.
And have you seen any specialists or have any testing done for that?
Yes, I have.
And what kind of testing have you done?
I went into a ear, nose, and throat doctor,
Okay.
and they tested my hearing and sent me for an MRI.
And what did the MRI say?
It said I had scar tissue on my eardrum from tubes being inserted in my ears when I was a little baby. I had a lot of ear problems, ear infections when I was a little baby.
Okay. And have you had like dizziness or vertigo?
Yes.
And are you taking any medications for that?
For the vertigo?
Yes.
No. I have meclizine
Okay.
for if the vertigo comes on, but when the ringing gets especially bad, I know something's going to happen. Usually when there's a lot of drainage,
Okay.
I take Sudafed. The doctor suggested if I feel something coming, take Sudafed because that should dry up the drainage, which would help alleviate some of the problems.
Okay. And any nausea or vomiting with the vertigo?
It has happened, yes.
Okay.
I vomited like 15 times every 3 minutes. It was horrible.
Okay. And when would you say your last episode occurred?
It's been a while, a couple of years.
Okay. And do you take any other medications?
I brought in my medication I take. Zyrtec, I take for allergy symptoms. Never had allergies before, but I
Okay.
believe I've developed some over the past few years.
And how often are you taking this?
Every morning.
And do you take it as directed, one tablet?
I take one tablet every morning. I don't take any more after that.
Okay. And do you take any other over-the-counter medicines?
Besides the Sudafed and the Zyrtec?
Yes.
No.
Okay. All right. And any other past medical issues, history?
Past issues?
Past medical
No.
history? Blood pressure?
No.
Okay. And what about family? Has your mom or father, are they still living?
Yes, they are.
And has anyone in your family ever been diagnosed with diabetes or?
Yes.
And who was that?
My mother has type 2 diabetes,
Okay.
controlled by food. She does not have to take insulin.
Okay.
And my grandfather, her dad, had diabetes type 1. He had to take insulin
Okay.
and check his blood sugar all the time.
And what about high blood pressure or high cholesterol?
Not that I'm aware of, but they ate a lot of food, so I'm sure that was probably an issue.
Okay.
It wasn't a major issue, but probably.
Any other ear issues in your family on your mother or father's side?
I had my grandfather, before he passed away, went deaf for the past maybe 2 years of his life or a year of his life. He was deaf.
Okay.
And his son, my uncle, wears hearing aids, is hard of hearing, and his son, my cousin, also hard of hearing.
Okay, and that's on your mother?
My mother's side.
Okay. And what about heart disease or stroke or any cancer?
Yes, my grandfather had cancer.
Okay.
Can't remember what kind. He passed away 16 years ago, so it's been a while.
All right. And what about surgeries? Any other surgeries besides the tubes in your ears?
I had a hernia surgery when I was a little baby, 12 months old or something like that. And I had an appendectomy when I was 18.
Okay. And what about social history? Do you drink?
Occasionally.
And what about smoking? Do you smoke?
No, gross.
What about smokeless tobacco?
No.
And how would you describe your stress level?
Very low.
Okay. And can you tell me a little bit about your work?
I work at an office supply company. I do accounting.
Okay. And do you use a regular telephone or do you use headphones?
For at work,
Yes.
I use a headset.
Okay. And does that bother your ear at all?
Nope.
Okay.
So I have to wear it in my right ear because my left ear is the one ringing one.
Okay. And what about immunizations? Are they up to date?
Yeah.
Have you ever had a flu vaccine?
Never had a flu shot.
Okay. All right. And can you tell me a little bit about this heel pain you were telling me about?
It's strange. It's not all the time. I think it's when I wear certain shoes,
Okay.
but it's not while I'm wearing them. It's after I've worn them. It's and it's quite painful.
And is it after you've walked for long distances or?
Sometimes, yes. Actually, after I wear my golf shoes,
Okay.
the next morning I am in pain on my right foot. It's like not really my heel. It's like around, like below my ankle, but above my heel or on the sides,
Okay.
and it's quite painful.
And on a scale of 0 to 10, how would you describe the pain?
I mean, it's tolerable. It's 4, but
It is.
it I don't know. I mean,
Is it like a sharp shooting pain that goes up through the foot, or?
it stays pretty much in the foot, but it hurts. It hurts bad. It's sometimes tough to walk. I have to stretch it really well. Once I stretch it really well, it gets okay, but it is still painful.
And is it when you step down on the foot, or is it when you stretch when you're in
It's
stride?
when I'm going up on the ball of
on
my
the ball
foot.
of your foot.
It's
Okay.
yes, that's when it hurts.
Okay. All right. Well, we'll move on to the physical assessment portion. So I will step out while you change into a gown.
Okay.